This is Dr. Dave and our continuing series on a plastic surgeon's perspective on anti-aging and wellness. And today I have with me one of my patients, Dr. Victoria Wilson, who's actually not just a patient, but she's also a psychologist. And today I want to talk about the role of hormones in anti-aging and wellness. And this is something that's a little bit controversial, but increasingly people begin to understand. And Victoria will tell you her story in aging and wellness and her use of bioidentical hormones. So Victoria, you have been using bioidentical hormones for how long?
At least a decade now.
So you started in your early 40s.
Yes, I started in my early 40s, and what I noticed is that I just had less energy. I was fatigued more, like I was dragging in the gym. Like I felt like my body composition was changing, like it was getting softer. So I consulted a female doctor who specialized in that. And she measured my hormones, and she said that your testosterone is really fallen. And that's the first thing that falls in women, and it starts way before menopause. And women will complain of sort of fatigue, motivation, lack of motivation. And what's interesting is a lot of women historically would be put on antidepressants, but they found that supplementing women with testosterone obviates the need for antidepressants, because what it does is actually enhances mood, energy, motivation, everything that's typically prescribed as related to depression. So she started me on testosterone first, because in my early 40s my estrogen and progesterone were still fine, and it made a huge difference. Right away.
That's a very good point, that you were very fortunate to find a doctor who was trained in bioidentical hormone therapy, because as you said, in classical medical practice, those patients who were complaining of those symptoms would most likely get a pharmaceutical product such as an antidepressant. And the thing is, and I am a little bit biased because I do believe that money talks. And the pharmaceutical companies have a huge amount of capital to invest in pushing their products, whereas natural therapies cannot be patented, and so they cannot have an exclusive right to sell those products. So they will not only push their patented medications, they will conduct studies to show how bad bioidentical hormones are. So I'm a little bit biased. You're one of the few patients and your doctor that actually got out there and said, listen, what is missing in your body is your hormones, and you can measure them. It's very simple. You can measure them in saliva, you can measure them in blood, but I think your doctor did the right thing, because it's important to measure.
And then you remeasure after. So you have the clinical effects, which you can describe, and you also have, biometric ways of measuring it. So, the effect was tremendous. Like, I felt I could work out more, my muscle responded better, my mood was better, sex drive, motivation, all across the board. And it's interesting that women also in perimenopausal period would also experience anxiety, and we know traditionally they would prescribe benzos like Valium, which was touted as mother's little helper. And it would just, eventually a lot of women would end up with polypharmacy. They would be on antidepressants, anxiolytics, and that would just lead to more weight gain. So I wanted to stay away from all that. I wanted as much as possible to naturally fix this.
So that's one of the downsides of the pharmaceutical that almost all of them cause weight gain, which will make you more depressed. And wellness is something that you feel. You can measure the hormones, but only you can tell whether you feel better or not. So you noticed the effect, but you were able to confirm it with the blood tests. Was she doing blood tests or saliva?
Yes,
she was doing blood tests, which are very accurate for testosterone. So you notice that immediately, because a lot of women will say, "I'm afraid to go on testosterone," because as a plastic surgeon, I talk to patients all the time about what makes them look better and feel better. And they come to me because I do Botox and fillers, which is going to be a separate talk. And they do it because it's wellness. It makes them look better, which makes them feel better. And there's a whole thing about the facial recognition loop, which causes that. But that's for a separate talk. So after testosterone, you were in your 40s. How long were you on testosterone before you had other
So I
bioidentical
started with the
treatments?
pellet therapy, right? So it's a pellet that's inserted. It lasts about 6 months, and it's a bioidentical hormone pellet. And then you remeasure it again 6 months later, and you also you feel it waning. So I would be coming back every 6 months, and then at about 45, she said, your estrogen and progesterone is starting to change as well. And then I remember I missed because you get busy, I missed 2 years, and came back, and she said your estrogen is at 0 now. You're actually officially, even though I was still getting my periods, she said you're officially in menopause, which is kind of interesting because she said hormonally you're in menopause. You may still get your period, but this is what the hormones show. And at that point, I added also estrogen to the testosterone pellet. Now, progesterone has to be supplemented via pill. For whatever reason, it cannot be added to the pellet.
Okay, so now you were 45, and you were perimenopausal, you think?
Yes, at 45 perimenopausal, and around, it's actually at 50, precisely at 50. It was kind of interesting. She said you're officially in menopause. Even though I was getting my period, hormonally, I was at pretty much 0. And they also check, I know, luteinizing hormones. There's a number of other hormones that sort of play into the determination of how to supplement.
Yes. So how did the estrogen and progesterone affect you in your feelings? Did you feel better?
So what I noticed, because I guess I missed 2 years, I got too busy, is that I started to feel like my skin was getting a little more lax. I actually felt, I was looking older. And one of the things is that I felt like also vaginal discomfort issues, which also plays into the estrogen, progesterone. You start getting some vaginal thinning and so forth. So again, with estrogen, progesterone, I felt better. It's not as dramatic as testosterone. It takes a few more weeks, but you do feel better. You get less urinary tract infections because I was getting them a lot without the estrogen and progesterone. You feel just more comfortable, and the skin, I think, you get more of that glow.
Well, this is something that is progesterone affects multiple things. It affects your brain, it affects your skin. So there are many organs that progesterone affects. It's not just the effect on the uterus and promoting gestation when a woman is pregnant, because that's when, and oftentimes when people say to a woman who are pregnant, "Oh, you're glowing," well, that's because of the high progesterone. So, the body runs on hormones, and it's not clear why nature has decided that women should not get these hormones when they reach a certain age. Maybe maybe nature has figured that you should become a grandmother
Mother,
and not be a sexual person because
people didn't live that long, I suppose. You know, if your average life expectancy was like, 50 or 60, then it's only normal because men also, enter andropause where their testosterone starts to drop. So I think nature, nature only gave a small window for procreation. That's what we originally designed for, right? Just to procreate and then sort of go away and be replaced.
I mean that is nature's basic instinct that you are there to procreate and create a new generation. Nothing else matters to nature.
And there's also, there's men discover they feel also. It's a different topic for male testosterone replacement. But anecdotally, I know there are a lot of men. It's been life changing for them as well. And for men, I know there's other ways to sort of supplement testosterone, like weightlifting. Has a so there's sort of natural ways to supplement testosterone as well. Um, and again, andropause is a real thing for a lot of men.
Mm-hmm.
And here's how important testosterone is for men. They did this study where they measured saliva, they measured male testosterone in stockbrokers, and they found by the end of the day, the stockbrokers that were the most successful and made the most money were the ones with the highest testosterone.
Yeah.
So testosterone is correlated with drive and energy and just this vitality.
And testosterone is easy to measure in saliva. And because almost all the hormones are derived from DHEA and cortisol, so it's easiest to measure them in saliva, which requires some specialized testing, but then there's no needle sticks involved. And it allows you to take multiple samples during the day. So one of the hormones I want to talk about is cortisol, because this is the basic hormone in our bodies. This is what causes you to wake up in the morning. So in the morning you measure your cortisol, they're sky high, and during the day it comes down slowly. So it's the cortisol. So some people have disturbances of rhythm, and if their cortisol does not fall at night, they can't get to sleep. And if they go to a regular doctor, they'll probably be prescribed a sleeping pill. But measuring your hormones is something that really should be done in almost as a routine part of practice. And it's something that you have to find a doctor who's interested in doing that.
I would say with the endocrinologist are more likely to be, or people who specialize.
Actually,
how would people find hormone specialists?
There's so let me tell you that bioidentical hormone replacement was really frowned upon by the medical establishment for
I remember
a long,
when
long
Suzanne
time.
Summers wrote her book, it would cause such huge controversy.
Yes. She was one of the first to promote Bioden and tell people that she's using it. And I remember one time reading, she's saying, "Oh, it's great. My husband and I have sex every day."
And they were like quite old, right? They were.
Oh, yes.
I think he was 85 or something like that.
I forget what age he was when they wrote that book. But yes, it was a change, and doctors are affected by what goes on in the media, and when they hear that Suzanne Summers is saying this, and their patients come in and say to them, "Well, I heard Suzanne Summers is doing bioidentical hormones. What do you think about that for me?" And then they have to get educated. So most of the doctors who are prescribing bioidentical hormones are almost self-trained in that they have gone to seminars, they've listened to people, and they've just begun to do it. Because it's not difficult to do.
Mhm.
I mean, basically,
I know
doctors are trained to measure things,
things,
and
yeah. And I know some people don't like the idea of a pellet because has to be inserted. But so there is other options. You can get, I know with testosterone, you can get a shot, and with estrogen, you can get a cream, and now I'm taking pills. So they come in different formats.
yes, yes.
Some people are just opposed to the idea of a pellet being inserted, and I understand
I understand that as well because these pellets are made by compounding pharmacies, and they do not have the financial wherewithal to do long-term studies to see how the dosage declines in their particular formulation. But that doesn't matter so much because patients will go back to their doctors and just tell them it's wearing off. It's
Yeah.
wearing off. I need, you know.
that.
And,
You
and
objectively absolutely feel it.
and this is why these talks are called anti-aging and wellness. And one of the things that women notice in menopause is that they're putting on weight.
Yes.
And that's a lot of the reasons why they would go to their physicians and say, what can I do about this? And that's why that was one of the major uh, drivers of bioidentical hormone therapy. That is, women became menopausal and they their waistline started expanding.
Yeah, because you lose muscle, and that's a lot of the issues with testosterone. It's very much contributes to muscle tone.
Yeah, weight gain and wellness go hand in hand. I mean, basically,
I know a lot of women are wary. They think because traditionally testosterone's been associated with men, so they think it's gonna masculinize them, that they're gonna get.
mhm.
But obviously, I've been on it now for a decade. I don't have any side effects. I know with women prone to acne, it may cause some of the pustules, but again, it's dose dependent.
Yes.
So then you just have to cut it down. And some women are afraid they'll get hair. Again, I had no issues with that, but maybe if you're more hirsute women, there may be slight effects to that. But I think all of the side effects are manageable and they're all worth it because if your mood is better, your vitality, and you just joie de vivre and your ability to work out and stay in shape, it's worth a couple of hairs you have to get rid of.
And that's a very good point. The mood, because a lot of women who are in menopause are irritable and will, their significant others will complain about their mood and irritability. And the women know it themselves, and they sometimes talk about brain fog. I think every woman should have their hormones tested and see what their levels are.
And again, some people are opposed to synthetic ones, and I tell them there are sort of natural alternatives. They may not be as effective, but I know there are herbs that are precursors, right, to estrogen, progesterone, and there's also a different herbal formulation that seems to increase testosterone as well.
Correct, correct. They are not as effective as bioidenticals. I understand the synthetic hormones are essentially a way for pharmaceutical companies to get a patent on that synthetic drug and make money off it. They make no money off bioidentical hormones, and so they're very set against it. So everyone has their viewpoint, and I understand their viewpoint. If I was in their shoes, I may do the same, But the whole thing about weight and wellness. So I want to go off on a tangent a little bit because we now have GLP-1 and semaglutide, and I know you have tried semaglutide. How would you compare the effect? And obviously, it's not like to like, and everyone's experience is different. in your personal experience, how would you compare the effect of semaglutides for weight loss as to how hormones made you feel?
Well, I think they are synergistic. The hormones give you energy, and I mean, again, they help you in the gym, but there's always those stubborn couple of pounds. The problem with me is that, and that's a personal thing. I don't know how everybody feels. Like I want to work out, but then I am famished. After workout, I want to eat, and then you have to make that choice. I should eat more protein and less carbs. But what's great about semaglutide is just curbs that appetite. So you can work out and not feel completely famished. And that's, I think, the crucial part to weight loss. Um, the hormones help with motivation to exercise and increasing muscle tone and so forth. But that curbing the appetite is crucial, and that's what semaglutide does. It's just you're not coming home and just eating everything in sight.
That's actually what all my patients tell me, that they're no longer thinking about food and
No food noise, no.
yes.
It helps with impulse control because, of course, everybody says, well, willpower, but we have limited amount of willpower, and our lives are complicated. We have to use willpower for so many things throughout the day. We're trying not to get into impulse purchases. We're trying to, not to lose our temper. So willpower actually is limited. That's what psychologists have proven. So if we can use something to curb our appetite, we can have more willpower to curb our shopping or to curb something else, drinking, whatever other people have issues with.
And if you feel hungry, you will eat. You cannot control those feelings and urges.
In the absence of semaglutide, to control your cravings, your hunger, you have to engage in stimulus control, which what it means really is not to have the stimulus, is to remove, the way I would do it before semaglutide is I just would have nothing at home. So you come home, you're hungry, you open the refrigerator, not much there, you kind of walk around, you think, should I order DoorDash, too much trouble, you just go to sleep. But again, that's, and I have kids, so they of course want snacks, how come there are no snacks? So stimulus control is what people have to do, is just not have the triggers. You remove the triggers.
Only a psychologist would come up with a term like stimulus control.
Right, but basically
I have
trigger
never,
control.
yes, triggers.
Yeah, but that's what, when you talk about psychologically, that's the stimulus is the cookie, the response is to eat it, right? So we call it stimulus control, basically not have the triggers. Basically eliminating, you could be hungry, but there's nothing to eat and you're tired and you're too lazy to go look for it. But again, you're still going to bed hungry. It still may impact your sleep and so forth and so on. So semaglutide eliminates those cravings. And it's just when you're not hungry, you can focus on other things.
So that's the whole point of weight and wellness, because they go together, and you need to have a doctor who can offer you the full range of therapies. And it's a bit of this and a bit of that. There's no one fix it. There's no this is the magical solution, because it's all about measuring things and how you feel. So you can measure your hormones, and you know how you feel.
Exactly. It's not for everyone. Like I have a girlfriend, and she said she told everyone she cannot be on testosterone because naturally she's a very high-strung, just kind of a very angry person. So things set her off, and she said, "I can't be on testosterone. I want to rip my employees' heads off." So again, that's why it's a personal. It has to be it's not the same thing for everyone. Everyone's different. Like I'm a very laid back, easygoing person, so testosterone doesn't really impact me all that much. But someone who is naturally kind of edgy, may not work for them. You add that testosterone, and now heads are off.
Everyone's an individual, and they're going to do what they feel and what works for them. So I had put my pharmacist friend on semaglutide, and a month later I asked him how he was doing, and he says, "Oh, it's great, but I've stopped taking it." I said, what do you mean it's great but you stopped taking it? He said, yes, I love to eat. And eating was one of the joys of my life. And it just took it away from me, so I stopped. So it's whatever is important to you, what makes you happy. You make the decisions. No one's going to tell you how to control your happiness.
Absolutely. And for some people, food is soothing. That's their coping strategy. And that is why, now, you know what? I had a psychological practice. We would get bariatric surgeons, they would refer patients to us before to measure their depression level before, because what they found is that people who were prone to depression and who used eating as a coping skill would actually get depressed and sometimes suicidal after bariatric surgery. They would lose all this weight. They would look great, but they would actually get depressed because the coping strategy was taken away. Now, the food was what they did. Eating is what they did when they felt down. Now you took that away, and you may look great and be thin, but what do you do when you feel down? And that's why it's important also the counseling part. For some people, you have to provide a different coping strategy. So if eating is what people do when they feel down, if you're going to take that away, you got to give them something else to do, whether it's exercise, whether it's socialization. There has to be an alternative way to get the same feeling, which we call actually in psychology the new roads theory. There has to be another road to accomplish the same thing. And like with your pharmacist friend, food is what soothed him. So if you're going to take that away, how else is he going to do that?
Yeah, so again, that's a new term that even as a doctor, I hadn't heard of, new roads theory. So let's talk about so you're on testosterone, estrogen, and progesterone just now. Which other hormones have you tried or used?
So initially, I also bought from Life Extension DHEA, and I supplemented that as well. But I found it really wasn't really necessary with the other ones. So those are the main ones. I take a testosterone tablet and estrogen tablet in the morning, and progesterone at night, and that seems to work really well.
So DHEA is the precursor molecule to almost all these hormones. So how it converts into the actual hormones, I'm a big believer if progesterone is missing, take progesterone, not DHEA, and hope it turns into progesterone. So, but yes, people do. I know physicians who prescribe it. I know patients who take it. But if what is missing, if you know what is missing, that's what you should take.
So those are the main ones. I would like to. I have anecdotal evidence with some of the other friends who use different HGH precursors, and they seem to feel great on it. I personally haven't actually tried it. I'd like to try to see, but also I also feel great, and sometimes if it ain't broke, maybe we should
Don't fix it. Yes. Well, thank you for stopping by and visiting and sharing with your experiences of hormone therapy. Very few people are so open and willing to share their personal story and their personal experiences. So I want to thank you for coming and stopping by today. Thank you.